I am Michelle Hendricks, and welcome to Powerful Tools for Caregivers. I am a caregiver specialist and master trainer with Powerful Tools for Caregivers. I have over 25 years experience in my field, working primarily with families, seniors, and caregivers of all ages, training them, teaching them to achieve their goals, find solutions, resolve conflicts, problem solve, and find resources for care, respite, and services. Later on, I will share more about my personal experience as a family caregiver. The Powerful Tools for Caregiver program was developed by a team of professionals in Portland, Oregon in 1998. Interfaith Samaritan Counseling Centers, the Buckingham Retirement Community, and a task force brought the program to Houston, Texas in 2009, and when I relocated to New Braunfels in 2011 to Central Texas. So who is a caregiver? A caregiver is anyone who assists someone else who is to some degree incapacitated and needs help. As our population ages, a growing number of American adults will serve as caregivers for loved ones who are young, disabled, frail, elderly, or suffering from a chronic condition. There are an estimated 65.7 million caregivers. That's astounding. Or approximately 29% of the U.S. adult population providing care to someone who is ill, disabled, or elderly. Often, caregivers do not identify themselves as such. They see themselves as a family member or loved one, just doing what they are supposed to do as a spouse or a partner or a child. However, they are more inclined to seek help and become more skilled if they identify themselves as a caregiver. We know that caregiver stress is emotionally, physically, financially, and spiritually straining on the caregiver. So many caregivers often feel isolated, frustrated, and exhausted by their caregiving duties. Caregivers are a diverse group of people, not only ethnically and culturally, but in their relationships and duties. They are daughters, sons, partners, husbands, wives, nieces, nephews, grandchildren, friends, and co-workers. Researchers know a lot about the effect of caregiving on health and well-being. The combination of loss, prolonged stress, the physical demands of caregiving, and the biological vulnerabilities that come with age place you at risk for significant health problems, as well as the potential for possible earlier death than the care receiver. Caregiver risks include high stress, worry, uncertainty, decreased well-being, increased physical illness, and diminished immune response. But despite these risks, family caregivers of any age are less likely than non-caregivers to practice preventative health care and self-care behavior. So what is Powerful Tools for Caregivers? It is an educational program, not a support group. It was not designed to be a support group. However, class participants do give and receive a lot of support from each other. It's a 6-week educational series, and each class is either 2.5 hours or 90 minutes in length. These classes focus on family caregivers, learning self-care skills so that they can thrive as individuals while providing care to a family member. The role of the class leader is to empower caregivers by teaching the tools of self-care. The class leader's role is not to fix things for the caregivers. It contains a scripted curriculum, and Powerful Tools for Caregivers has been through extensive and continuous development and evaluation. It has been standardized in part so that the quality and outcomes of the program are maintained. It is a train-the-trainer model. To help with the widespread dissemination of the program, class leaders are trained, and once they are experienced in co-leading classes for family caregivers, they may become trained as master trainers and train additional class leaders. Using a train-the-trainer approach, Powerful Tools is successfully serving family caregivers in cities, small towns, and from diverse ethnic communities throughout the country. An estimated 70,000 plus caregivers have benefited from the Powerful Tools for Caregivers materials, and our program's curriculum is available in English, Spanish, and Korean. So let's take a look at the curriculum. In Class 1, we cover the topic of taking care of you. The first week of the class series sets the stage for the entire course. It emphasizes that the focus is on you, the caregiver, not the family member receiving care, and that the caregivers will develop a box of self-care tools. In Class 2, we cover the topic of identifying and reducing personal stress. 4 steps are presented for effective stress management. First, identifying the warning signs. Then, identifying personal sources of stress and teaching the tools to reduce stress. Changing what you can and accepting what you cannot change. Participants learn how to change negative self-talk, which increases stress and erodes self-confidence, to positive self-talk. And then fourth, taking action. Beginning in this class, caregivers learn relaxation activities that are easy to incorporate in their daily lives. In Class 3, we cover the topic of communicating our feelings, needs, and concerns. Being able to communicate constructively is one of a caregiver's most important tools. Caregivers learn how to eliminate barriers to effective communication and to develop tools to communicate in ways to get help and support. Then in Class 4, communicating in challenging situations. In this class, participants practice 2 communication tools, DESC, D-E-S-C, for assertiveness, and Aikido, which is helpful in aligning with someone in a difficult situation. In Class 5, we learn from our emotions. Our emotions are messages we need to listen to. And this class emphasizes that feelings occur for a reason, and that feelings are neither good nor bad. They just are. This class focuses on identifying ways for dealing with difficult feelings, especially anger, guilt, and depression, and resources for professional help. Then in Class 6, we tackle mastering caregiving decisions, and the focus of this class is on the internal emotional process that caregivers go through when they experience a life change. In chronic illness, we know that there are a lot of changes that occur in that caregiving journey. So there are tools for dealing with these changes and for making tough decisions, including a 7-step decision-making model. A realistic and optimistic attitude about present and foreseeable caregiving needs is also very important. The Powerful Tools for Caregivers program is modeled in its curriculum, teaching methods and dissemination after the Chronic Disease Self-Management Program, a model patient education program based on the concept of self-efficacy developed by Dr. Kate Lorig and colleagues at the Patient Education Research Center at Stanford University. At the heart of the program is the concept of self-efficacy, or your confidence, which is a person's belief that he or she can perform a behavior necessary to achieve a certain outcome or effect. Self-efficacy-based education is concerned not only with the skills one has, but also with the judgments of what one can do with the skills one possesses. The curriculum utilizes 4 empirically verified strategies for enhancing the self-efficacy or self-confidence. Skills mastery is a method of learning, practicing, and experiencing success in helpful behaviors and practices. Practice is the key to gaining self-efficacy or confidence. One of the best ways to foster mastery is to have caregivers set goals for themselves. In the Powerful Tools class, participants are invited to develop an action plan each week, and through this process, class participants gain confidence in using this tool. Modeling is the Powerful Tools for Caregiver program, which is demonstrated through the use of co-leaders. They describe effective caregiving practices and model the use of the tools from their own experiences, as well as by providing opportunities for class participants to help each other in finding solutions to problems. And the reinterpretation of feelings and attitudes. One cannot change the fundamental nature of Alzheimer's disease or other chronic diseases of adults. Caregivers can, however, shift their focus from the negative aspects of the disease to an acceptance of the realities of their situation. And during the Powerful Tools for Caregiver classes, caregivers develop a sense of positive support from other class participants. Through sharing their feelings and experiences, they carry these reinterpreted attitudes into their caregiving role. Persuasion is a standard approach in health education. Rather than relying on persuasion as the primary method for changing behavior, persuasion supplements the other three methods. Examples include using caregivers to set more realistic goals than they might otherwise do, to report on the evidence of the effectiveness of the techniques and the tools that are taught during the classes. For many years, the Powerful Tools for Caregiver program has worked with researchers to verify the statistically significant outcomes of family caregivers who attend the 6-week class series. Data from class participants' evaluations indicates that the Powerful Tool program improves self-care behaviors. We see a very significant improvement in behaviors such as the use of relaxation techniques, exercise, and health self-care. And the management of emotions. There is a reduction in anger, guilt, and depression, and increased self-confidence in coping with caregiving demands and challenges. Also, the use of community resources. There's an increased confidence in finding and utilizing the community resources. Research findings were based on a broad and inclusive approach to diversity. The 6-week Powerful Tools class has been shown to have significant positive impact on caregiver health for a diverse group of caregivers, including spousal or partner caregivers, adult children, and other family caregivers in a variety of settings, including those living in rural and ethnic minority communities. In 2012, the Powerful Tool for Caregiver program was deemed to have met the highest level of evidence-based criteria set by the Administration on Aging. Here are some quotes which show how each of the 4 outcomes have impacted caregivers with improved management of their emotions. His hateful remarks do not spark my anger. I know I'm doing my best. I have sticky notes of encouragement around the house. I found out that I can't change the existing condition for my husband, but I can change my outlook and how I react. It reinforced my confidence level that I am doing the best I can to take care of my husband while taking care of myself too. And the class made me aware of how important it is to take care of myself and my personal happiness in order to do a good job. By taking the Powerful Tools classes, caregivers significantly increase their knowledge of community resources. Thanks to this class, I now have a list of community agencies to contact, and I know that the Alzheimer's Association has a monthly support group. Now I'd like to share a little bit of my personal caregiving experience. Caregiving has left an imprint on my heart from caring for my own mother, who was diagnosed with dementia, who moved into a memory care facility in the summer of 2012. Prior to that, for 4 years, I helped care for my dad. He lived in VA hospice care for 3 years, which was a very long time, with multiple forms of cancer before he passed away. For 18 years, I served on staff of a large Presbyterian church in Houston and had the responsibility of caring for multiple generations of caregivers in the area of pastoral care and older adult ministry. And now I'm helping my uncle, who is struggling with heart disease, early memory loss, and the recent death of his only child, my cousin, last November. This is a delicate imprint on my life and in my heart, and it is incomprehensible sometimes. I often see their faces and many more whom I have served and provided care for, and the people I meet who have these diseases. My involvement with Powerful Tools equipped and empowered me for the caregiving journey by providing the tools, experience, and know-how to navigate the extremely difficult family caregiving circumstances. Now my calling and my passion is to help replicate Powerful Tools for Caregivers in individual lives, churches, nonprofits, businesses, and communities. And that is why I'm an advocate and supporter of the Powerful Tools for Caregiver program. It has helped me through some of the most challenging situations in caregiving in both my personal and professional life, and provided the tools, the guidance, and the resources that I needed along the way at different stages of the journey. I am just one of thousands of caregivers that the program has affected. The Powerful Tools for Caregiver program content has proved to be culturally appropriate for underserved rural and ethnic communities due to the curriculum design. It provides the opportunity for class participants to individualize the program to their caregiving situation through brainstorming, paired or group activities and discussions, making action plans to apply class curriculum to their personal situations. The success of the program may be attributed to several key aspects of the program: the carefully designed and scripted curriculum, and the class leader training provide and ensure uniformity in presentation, and effective management of the class setting. The generally high overall rating suggests that the curriculum works well for co-leaders with a wide range of prior experience in training and education, and that it can be effectively used in a wide variety of settings. 3 primary factors account for the success of achieving positive self-care outcomes across a wide cultural and economic and geographic spectrum. It addresses universal caregiving challenges. Powerful Tools addresses many of the caregiving challenges, such as uncertainty, work, guilt, work overload, and lack of assistance. It also encourages individual adaptation of the tools. The action plan used in each session specifically encourages selection of pleasurable activities that are unique to the individual caregiver. And it creates opportunity for new approaches. Finally, and most important in any education program, participants are encouraged to take advantage of the opportunity to learn a new approach to the challenges they face. Now we will look at the Train the Trainer model. This diagram shows how the program is replicated. Class leaders are trained to be master trainers and then begin training new class leaders who then teach the 6-week program series for family caregivers. To sustain the program post-grant, multiple collaborations and partnerships of varying levels of commitment have been developed with staff at organizations like Area Agencies on Aging, AARP, Cooperative Extension Services, parish nurses, Veterans Administration, hospitals, healthcare systems, faith-based organizations, churches, and hospice programs. The Powerful Tools program also has formed partnerships with corporations such as Intel and Nike to offer the Caregiver Assistant Program to their employees. A 90-minute version of the program was first created in response to the needs of employed caregivers, and there are many, and the desire to schedule classes in the workplace during lunchtime. The 90-minute program has been utilized with the general public since its first application in workplace settings and has achieved the same positive outcomes for participants. The Caregiver Help Book is the companion book for the 6-week class for the family caregiver. The chapters in the first half of the book basically cover the content of the 6-week curriculum. Chapters in the second section of the Caregiver Help Book address specific issues. Topics include hiring in-home help, making decisions about care facility placement, helping the person with memory impairment or depression, handling driving issues, a huge one, caregivers of veterans, caregivers of children with special needs and chronic illness, and sharing and dealing with grief and end-of-life issues. The Caregiver Help Book is an excellent standalone resource for family caregivers and is available on the powerfultoolsforcaregiver.org website. So, how do you become a class leader? As mentioned earlier, Powerful Tools for Caregivers is a national program sustained by extensive collaboration with community-based organizations. It is a train-the-trainer model program with detailed scripted curriculum. The goal of the program is to build to capacity to replicate the program through affordable class leader and master trainer trainings. Increasing the number of classes available makes it possible for more caregivers to benefit from the proven outcomes of the Powerful Tools program. And through collaboration and partnerships, we are working to spread Powerful Tools in San Antonio, the Hill Country, Central Texas, and across the country. So if you would like to offer the 6-week class for caregivers in your community, you must become a trained class leader. What is required to become a class leader? Because all the classes are co-led, you need to have a co-worker, a co-leader to work with, some group facilitation skills, a sponsoring organization to help you support in the implementation of the program, complete the 2-day Powerful Tools for Caregiver class leader training, and agree to the quality assurance standards that are outlined in what is called the Essential Powerful Tools for Caregiver program form, which helps to standardize the program and maintain its positive outcomes for family caregivers. What is the time commitment for Powerful Tool class leaders? It's a 2-day training, 2 full days, plus any travel time. And class leaders will teach at least 2 caregiver classes within the first year. Where can I be trained as a class leader? Our trainings occur throughout the year around the country. So for the current list of class leader trainings, check the schedule on the Powerful Tools for Caregiver website or contact the national office at 503-719-6980. That's powerfultoolsforcaregivers.org or 503-719-6980. Or another option is to arrange to have the Powerful Tool for Caregivers National Office send master trainers to your area to train 12 to 20 class leaders. So what are some ways that organizations can support a Powerful Tools for Caregiver class leader? by sponsoring staff time and travel expenses to attend the 2-day Powerful Tool Class Leader training, to provide staff time to co-lead the caregiver classes, provide administrative support such as marketing of the classes, class registration, and purchasing copies of the Caregiver Help Book, or provide space for the classes. Here are a few quotes from class leaders about the value of the program. It never ceases to amaze me how transforming the course is. The dramatic change in the demeanor of participants from the first to the 6th class. The program materials stand up against the test of time. That was a comment from a class leader in California. From Texas, I cannot express how important and how insightful these classes have been for me, let alone how much I have witnessed a transformation in each class. Participant, the program truly produces results and makes a difference in the lives of caregivers. And then, simply stated from Arizona, thank you for having developed an incredibly simple program so seniors and family caregivers can find the tools they need to manage their lives and care for those they love. Once you become an experienced class leader, you may be interested in becoming a Powerful Tools Master Trainer. Master Trainers have the capability of training additional class leaders. So in order to become a Master Trainer, you must take a minimum of 3 Powerful Tools teach a minimum of 3 Powerful Tools Class-Week series, 6-week series, complete a teleconference with the Powerful Tools National Office, have a sponsor organization with whom to work, and agree to conduct a class leader training within 8 months of the teleconference. Please know you can contact the Powerful Tools for Caregivers program office to learn about caregiver classes or becoming a trained class leader by visiting their website at www.powerfultoolsforcaregivers.org. I would also like to offer my contact information as a Powerful Tools for Caregiver Master Trainer. I'm a caregiver specialist, advocate, class leader, and master trainer with Powerful Tools for Caregivers with over 25 years experience in my field. Currently, I work as an independent contractor, consultant, speaker, and workshop leader to individuals, churches, nonprofits, businesses, and communities, helping leaders develop effective training, programs, and ministries. You may contact me at 832-731-6127 or tmichellehendricks@icloud.com. That's 832-731-6127 or tmichellehendricks@icloud.com. Thank you for joining us today. We hope the information about Powerful Tools for Caregivers and the Caregiver Help Book has been useful and helpful. You have the information from our Powerful Tools for Caregiver National Office and my personal contact information. Please feel free to get in touch with us if you have any questions. Remember, we want you to thrive as caregiver individuals, not just survive. And the Powerful Tools for Caregiver program will give you over 35 tools to do so. Now it is up to you. So we wish you the best on your caregiving journey. Thank you.